I think women all over the world are the backbone and the centre of society and of communities. Anything that affects them affects everybody.
I knew at that very moment, as I was treating one woman with stage 4 breast cancer, that there were another dozen women, or dozens of women out there with stage 1 and 2 breast cancer who weren't going to come find us until later.
Project Medishare for Haiti is based in Port-au-Prince and the Central Plateau. It's a centre where women can seek treatment for cancer. We run preventative and detection services as well. The challenges that women in Haiti face metastatic breast cancer are very, very complex. They range from economic to very, very complex social and cultural things as well. There's a lot of stigma attached to the disease. Many women actually choose to refuse to have a mastectomy.
80% of the women come in stages 3 and 4 breast cancer. I got sick of watching 30 and 40-year-old women come in and die. I understood as a doctor I couldn't do anything more, and we needed to reach out and find new solutions.
The SPARC Mbc award will go to fund the awareness and engagement component of the Women's Health Centre and the cancer programme. The first phase is a research phase where we will work with our local partners to really try and document and understand the barriers and complex social and cultural narratives about breast cancer in Haiti. We will use this information to build a toolkit for community health workers to interface between health services and the community.
The SPARC Mbc Challenge Grant is going to help us to create a medical network of doctors and community healthcare workers to liaise with the communities, and then the women's health promoters, who will be our patients and breast cancer survivors, who will go out into their communities and churches to be able to communicate and get women in sooner, and then also be empowered to complete their own treatment. What we're hoping to achieve with the SPARC Mbc Challenge Grant is to get women into care sooner, to decrease our mortality rate on kind of a medical level, but on a human level to get women to buy into the fact that, to the belief that they deserve this healthcare as a human right and cancer care as a human right, that they demand it. We put life ahead of everything. We say in Creole, la vie avant tout, so it means life ahead of all. That no matter what it is, we're going to try and do what we can to make sure that we survive.
It's amazing that the most vulnerable are also the ones with the most strength. Really, their strength and perseverance is astounding.